health news making headlines now. There's now another new growing trend with people on GLP-1 weight loss drugs like Wegovy, Ozempic, Mounjaro, and Zepbound. It's called microdosing, and patients are doing this for several reasons: cost, side effects, and weight loss maintenance. So joining me now to explain is Dr. Sonal Harder with Dignity Health Medical Center. She's also board certified in obesity medicine. Not everybody knows what microdosing is, so explain what that exactly is.
Microdosing, Tram, simply means smaller dose than a recommended dose. So for example, if you are given 1 milligram as a dose, you kind of lower the dose. Now, this is not based on evidence-based, so we don't recommend this in our obesity practices. This is more anecdotal, so patients are coming back and dosing lesser, but this is not recommended or supported by any evidence at this point.
Okay, so why would people microdose then?
So number one, side effects. We know that these medications do have some significant GI side effects like nausea, vomiting, constipation, diarrhea. These medications are expensive. And sometimes when patients reach a weight, that they desire, most patients desire to back off on the doses with the hope that they can extend the medication a little longer because of cost and as well as for side effects. But again, I want to make it clear it's not recommended and not based on science at this point.
I'm glad you talked about the drawbacks and the negative with that. But honestly, it makes sense why people would do that, right? However, another problem is that people could probably misdiagnose themselves, right?
So overdose or underdosing and contamination, because if you think about these syringes, these are pre-filled syringes, and most of microdosing is happening from the compounded pharmacies. So you have to draw the dose by yourself and inject the dose, which means you could underdose, overdose, or even get the syringe contaminated.
Right.
So these are some real potential side effects of microdosing, something that is not established yet.
Sure, yeah, not backed by any evidence just yet.
Correct.
All right, I want to get to another big story that was in the news recently. There was a new study. It compared Zepbound and Wegovy. It lasted 72 weeks, and it found that Zepbound apparently was more effective in helping people lose weight. Why is Zepbound better?
So if you think about Zepbound and Wegovy, Zepbound actually impacts 2 receptors in our body, and both those receptors are responsible for reducing appetite, regulating blood sugars, as opposed to Wegovy that impacts 1 receptor. So you can think about 2 different pathways working towards weight loss and blood sugar regulation versus 1 pathway. Although I have to say, the study showed that the Zepbound, had 20%, about 20% weight loss in the population, and Wegovy had about 13.7%. That is also significant, but yes, compared to Zepbound had a little bit higher impact.
Okay, so if the goal is to lose weight and all these other people are on Wegovy or Mounjaro or all the other ones, does that mean they should hop on the Zepbound train? I mean, what should they do?
Not necessarily. So if you're on Wegovy and if you are actually losing weight, not having side effects, and you are going in the direction that your doctor wants you to, there's really no reason to switch to Zepbound. Now, some of these decisions are so based on what insurance covers. We all know that most of these medications are very difficult to be covered by your insurance companies, whether it's Zepbound or Wegovy. So I say if it's working for you, there's no reason to switch.
Okay, so that was my next question, because as a doctor, with so many options, I mean, how do you know which one would be best suited for the patient? You talked about insurance. I mean, is that a big factor?
That is the biggest factor in my practice. So when I choose a medication, I really have to see what the insurance covers, what the copay is. Just because it's covered does not mean your patient can afford copays. These medications are very expensive. So really, and then are you covering diabetes? Does the patient have a history of heart disease? We know that Wegovy and semaglutide, Ozempic are also beneficial in patients with heart disease. So taking into consideration other factors along with weight loss as a goal is very important.
Yeah, it's not one size fits all.
Exactly.
All right, Sonal, great information. I'm sure we'll be talking about this in the weeks to come. Thank you.
Trim.
All right, Troy.
All right.